we can prevent 80% of all strokes. It's a powerful message that it's not something that you are bound to have if you have the risks.
It really comes down to them understanding what the signs are and that they need to treat it like a medical emergency. I think most people are aware now, with a heart attack, okay, I want to take an aspirin and this is what I want to do and these are the signs and it's an emergency. I need to call 911. What we need to do is we need to get the public understanding that stroke is a medical emergency, that we have options if we can get you here in time.
You cannot predict when a stroke happens. And stroke is a devastating disease. It's the leading cause of disability in adults.
It's really important to teach patients the signs of stroke. So sudden onset weakness on one side of the body, sudden onset trouble with your walk or your balance, maybe leaning to one side or having problem just putting those feet in front of the other, coordination. Sudden onset headache, often described as worst headache of your life. Sudden onset changes with your vision. You may lose vision in one eye or in both eyes in just parts, or complete vision in some cases. And then the last one being sudden onset with your speech or your language. And it's either your ability to put appropriate words together or understand what others are saying, or sometimes it's just in the slurring. But in all cases, what's most important if they notice some sudden change is that they call 911.
Without that urgency to the approach, without the consistency of it, without the organization of delivering the care that is needed at the right time to the right person in the appropriate circumstances, the benefits will evaporate and the risks will become much higher. What are my risk factors for stroke? What is it that predisposes me to have a stroke? We know who is at risk for stroke. Those who are older, of course, after the age of 65, every 10 years doubles the risk of stroke. Those who have hypertension, those who have high cholesterol, heart disease, atrial fibrillation, a specific type of abnormal heart rhythm, having blockages in the blood vessels, having diabetes, and most importantly, anyone who had a stroke in the past. Lack of physical activity on a regular basis increases the risk of stroke, and regular, moderate physical activity, not more than half an hour of walking 3 to 4 times a week, is enough to get that benefit.
And taking the medications, following up with their primary care physician on a regular basis to monitor blood pressure, to monitor their diabetes, following through on their diet.
Do you have aneurysms in the family? Has anyone died from an aneurysm in the family? Do you have strokes in the family? All of these may increase your risk. If you're African American, you need to be doubly aware that the risk is double for African Americans, and the risk of dying from it in African Americans is double as well.
One of the things that sets us apart clearly is in the specialists that we have access to, the stroke specialists, the neurosurgeons who are trained in these endovascular approaches for treatment of acute stroke. So the comprehensive nature and the level of services that we provide certainly differentiates us from a lot of hospitals. Being a primary stroke center is really a demonstration by the organization that they are committed to delivering the best quality care for their patients.
All of us need to recognize that stroke can happen at any age, to anyone, at any time. You can do something about it, and you can prevent it from happening.